is Bill Gravel, Williamson County Judge. You spell my name Gravell, and you spell my first name Judge. That was humor for those of you that have lost your humor in this last year. Today, and I want to make sure, Connie, can you hear me well?
Yes, sir, I can hear you.
Perfect. I just wanted to make sure. I want to start with thanking all of you for joining us today. I wanted to give you not only a brief update of our vaccination plan, but I want to share with you this Sunday for Bill Gravel would be 1 year from the very first day that I've heard about COVID-19. It's been a difficult year and a challenging year. But it's been really quite an amazing year, an extraordinary year, watching people work together to solve problems and to solve challenges. And part of what we're talking again about today is about the community coming together to solve the challenges that are before us. Unfortunately, this week we passed a couple of grim milestones. We had over 30,000 people that tested positive for COVID, and we passed 300 deaths. In fact, the latest number that I have for those that passed away in Williamson County because of COVID is 311. And I'm mindful that we're dealing with something that costs people their life every day. So to you reporters that are covering this and doing your job, just remember that when you do your work well, it saves lives. So we're really grateful for that. The purpose of the press conference today is to talk about caring one for another. In Williamson County, we began a vaccination plan, and we have been really quite successful in being able to meet the needs as best as we can with the vaccines that we have available. I do have some current numbers, and if you'll forgive me, the current number of doses that have been administered in Williamson County as of this moment are 34,678 doses. We've also been able to complete the second vaccine for a few thousand individuals. The county, along with our public-private partners, are working really in a very, working rapidly to meet the needs of our community. Let me say as county judge, though, from the onset, it is difficult, the project that we're undertaking, because we really see about 450,000 people that could qualify for the vaccine in Williamson County, but when you're talking 2 shots, you're really talking about 900,000 vaccines. And at the rate of receiving 6,000 to 8,000 vaccines a week, you certainly can do the math. It's going to take us a long time to get there. But we're working really hard. I'm very grateful to Family Hospital Systems and the mega site that they have set up at Kelly Reeves. One day this past week, they hit a record number of vaccinations in one day, and they topped 3,200. Family Hospital Systems has been amazing to work with, and using all of the resources they have to meet the needs of our residents. I will say this, though, with Family Hospital Systems, along with other providers that we're contracting with to open other mega sites, we can open all of the mega sites that we want in Williamson County, but until we get a significant amount of vaccine, it's still going to be fairly slow. We're grateful for the work that the Health District, or Williamson County and City's Health District, is put in. Not only were they able to complete the 1A category, but they are now in the process of circling back and checking on our nursing homes to make sure that we're vaccinating every senior. I think one of the disappointments that I have as county judge is just this week we have discovered 4 nursing homes that have not even vaccinated. And so through the effort of the health district, along with our paramedics and working with Family Hospital Systems, we're able to put in shots in arms of some 600 residents in areas, senior care facilities. So I'm grateful for their hard work. We're working really hard to reach out to those that are not able to get out, and coming up with a game plan a long-term game plan for vaccinating those that are homebound. What I want to share with you in the way of news is this. This next week, family hospital systems will be vaccinating on Monday and Tuesday at the Kelly Reeves site. And then on Wednesday, family hospital systems or Curative will be vaccinating at a new location here in Georgetown, which will be our Georgetown High School football stadium parking lot. If Curative is ready to go, they will run with it this week, and if not, Family ER will take it for one more week. The goal of the county is to have family hospital systems manage kind of the west side, and then have Curative manage a vaccination site in Georgetown, ultimately, as well as opening a vaccination site at the Dell Diamond. We have also asked some of our hospitals to help us, and this week we will be transferring 500 doses to Scott and White Health Systems, Baylor Scott and White Systems, which will be vaccinating, from my understanding, at their Round Rock location. So the county through our hub receives a number of doses each week. And family hospital systems, myself and our senior team have conversations about where those resources need to be shifted, falling in the 1A and the 1B category. Much like discovering the nursing homes, when those were discovered through the health district's hard work, we were able to shift those vaccines to make sure that we could get shots in arms. The real purpose in today's press conference, and I'll certainly take questions at the end, is to talk to you about a new program that has been going for a few days, but that we will be expanding here in Williamson County. We refer to the program as VRTA. VRTA stands for the Vaccine Registration Technical Assistance Sites, the VRTAs. And let me explain from a personal story why we need VRTAs. In Williamson County, right now, we have 81,282 senior adults that are age 65 and older. As of just a few moments ago, only about 3,000 of those individuals have been vaccinated. This past week at Sun City, where our first VRTA site was set up, and really what it was county employees and volunteers helping senior adults who couldn't operate technology, who didn't have technology, helping them to be able just to register to get a shot. And by the way, the VRTA centers won't be just for senior adults. It's for anyone who needs help and assistance in signing up for the vaccination. Just this past week, a wonderful lady that I've known for years was standing in line, an honorable woman. She was tense, she was frightful, she was scared. Her husband had passed away about 4 weeks ago, and she just couldn't figure out how to get online and sign up, or if she was even really signed up. And what we've learned through the vaccination mega sites is that there's a percentage of our population that just needs not a handout, but really a hand up, and helping them operate the technology so they can get on the list. With the VRTA sites that we've stood up, we're using county technology because we want to assure that all of the data that is put in there is kept confidential. But we are seeking partnerships with area churches, and this week the VRTA Center will continue to operate in the Sun City Ballroom, even though we're moving the vaccination location over to the football field, to be able to assist anyone who needs to sign up for a vaccine. It is our plan that next week we will stand up a VRTA Center in Cedar Park and simultaneously in the city of Taylor. We're really grateful. We have area churches that will be making their facilities available, and in the days ahead we will share that information. And churches as well will be providing volunteers to help our neighbors. And one of the messages I really would like to convey as county judge is that for all of us, we can make a difference today if we will think about who lives around us. Many of us have helped our moms and our dads and our grandmas and grandpas sign up to get on the list for vaccination. But my question to you is, what about the neighbor that lives to your left, or the person that lives across the street? Let's not assume that everyone is technologically gifted, but let's assume that everyone needs a helping hand. And so I call on all residents, not just in Williamson County, but in Texas, to check with your neighbor and to ask them if they need some help signing up at one of the vaccination centers. Also on Monday here in Williamson County, we'll be standing up a vaccination question call-in line. And on Monday, that call-in center will be available. I would share with you the number, and I will, but I would ask that you not broadcast that or promote that until Monday. Our phones will be lit up here in just a matter of minutes. Michelle, can you share that number online? So Michelle will be sharing that number online, and that will be become available on Monday. I want to say that it's been amazing watching our people come together to help one another. But I want you to know that as county judge, I am deeply concerned that our most fragile and important population doesn't have the ability or the know-how to get a vaccine. I'm frightful of those senior adults and young adults that are just literally hiding out at home because they don't know how to fill out the pre-registration form. And so I really just would ask our public to be considerate and to be kind. And if you do have a senior that you're helping fill out their paperwork, when you know that they have an appointment, maybe you do something kind like offer a ride to the vaccination center. Our folks, we're trying to offer appointments in the daylight, but some of the centers have stayed open to as late as 9 o'clock at night to help meet the needs. And some of our seniors are not comfortable with driving after dark. Heck, I'm not comfortable with driving after dark. So I just would ask you to be thoughtful and be kind of those that are around you. We need neighbors checking on neighbors to make sure that they're vaccinated. Now, remember that everybody has a right to be vaccinated, and there are some that choose not to, and you shouldn't be offended by that. You should just know that that's their right living here in America. But just like the wonderful lady that I saw this past week, they need a hand. I'd also share with you too that this week I've spent much time at our vaccination centers, and I spent some time at our Virtus Center and at our vaccination station there at the stadium. It was amazing. The level of joy and happiness was high, and the countenance was positive. And then when we went to the Virtus Center and I was able to see the folks that were waiting in line and that were confused and angry about how even to register, the tension was palatable. Our folks are exhausted, and I just would really challenge everyone, let's be patient, let's be kind, and let's help our seniors. That's what I have for you at this time, and I'll be willing to take some questions if you guys will promise that you'll stick to the concept that we're talking about, a vaccination plan for Williamson County in Central Texas.
Thank you everyone for being with us this morning. Our first question is from Richard. Are those who have already registered through FHS portal indeed registered? He believes he's heard that many have not received acknowledgement of this, and is the portal taking more registrations?
Richard, that's a great question. First, you do need to know that everybody that has signed up and completed the registration process through FHS, they are registered. In the beginning, they weren't able to send out confirmation emails because of the speed in which they were coming in. And let me give you an example. There was one period when the portal opened that in 6 minutes and 40 seconds that they had over 800 completed registrations. So the speed in which stuff is coming in to FHS is lightning speed, Yes, the portal is open, but just remind folks that they're just registering for the vaccine, and when they work through the list and the prioritization step set by the state, that they will be contacting those individuals via email.
Great. The next question comes from Allison. She's asking, will there be different registration links for various vaccination sites? Example, Curative, Scott and White.
So, Allison, the question is, right now, for this week, and you have to remember we're working week by week, and you understand the complexity of that. Week by week, the folks that have already pre-registered with family hospital systems, they will take, for example, 500 of those and give those to the Scott and White healthcare system. And Scott and White will schedule that appointment with those individuals. And the same will occur with Curative until we've been able to whittle down through the list of folks registered. The fact is that once we've worked through that list, that there will be 3 different portals that will be available for registration: Family Hospital Systems, Curative, and Baylor Scott and White. But Baylor Scott and White, even on their own, has databases of thousands of individuals that are in that 65 and above, or thousands of individuals that are in that 18 and above with some comorbidity.
Claire Osborne is asking, can you say where the VERTA sites will be set up on Monday?
Claire, I love how you always try to pigeonhole me. So the VERTA site on Monday for sure will be at the Sun City Ballroom. And then I would like to wait until Monday, Claire, to give the information on the Cedar Park location and the information on the Taylor location. In the end, the goal is to set up is we need to take this ability into the neighborhoods nearest the people. And so those will be the 3 this next week, and on Monday we'll be releasing the addresses in those locations and their times.
Univision is asking, will the outreach and phone line assistance for vaccines be in Spanish as well? How will the county make sure that people that qualify for the 1B phase are the ones that are registering and getting the vaccine?
Well, it's really a twofold question. One is, will the phone lines be bilingual? And the answer is C. They will be bilingual. The second answer is something that is disheartening to me as county judge. There are no standards that we can implement or put in place to preclude anyone from being vaccinated. For example, someone could sign up and say, well, I've got another comorbidity. And there is no way, according to the standards that we've been issued from the Department of Health and Human Services, that we can inquire as to what their other ailments may be. We can't do that. And I want to say this. What I saw at our mass vaccination sites, I saw some younger folks going through those lines. And maybe they had other health-related issues, and I pray that they did. God, please forgive anyone who's willing to step in front of a senior that needs to be vaccinated, and they're willing to lie to do that. We need to make sure that if we're signing up, we fall within those parameters. But there is no way that the county or the health authority or even family hospital systems can enforce that or restrict people from being vaccinated.
Rudy is asking, will there be a team going to residents in person, or is the plan to have churches provide the outreach teams?
So, Rudy, there's 2 answers to your question. We've asked all area churches first to do their own community and go door to door if necessary. The second part of your question is about vaccination to seniors. Williamson County is currently working on a plan through our health district with our EMS system in conjunction with Curative for mobile vaccinations that will go door to door for those that are truly homebound. But again, it is a great plan. We have some really good shovel-ready plans. The reality is we just don't have the vaccine to do that, but we are making the plans now for a mobile vaccination center that could go door to door.
Rudy also is asking if a person in a nursing home or memory care misses their shot opportunities, how will they get back in rotation and not be overlooked?
Yeah, so that's really a good question, and I know you're asking it for a personal reason, but if someone's in a memory care facility or one of our local senior care facilities, nursing homes, it is the responsibility of the medical director of that facility or the charge nurse to make sure that that happens. And what I would encourage folks is they need to keep pressure on the local nursing homes or the local memory care facilities. You're paying money for your loved one to be there, and they're the ones that need to be held accountable.
Richard has asked, do we know how many doses we have allocated for the next week?
Yes, I know that our next week allotment was received yesterday, and we received 8,000 doses. I also know, 8,000 doses at our family hospital system. But there are additional doses that are being provided to a lot of our health providers that are the second shot to follow up on that first shot. So if you'll give me just a second. Richard, I love that I can see in real time where we're at. I know this week is week 7 and that there were a total of 10,375 vaccines allotted this week. And I know for next week that there was somewhere close to 15,000 vaccines allotted. Beyond that, including the family hospital system's dosages.
Williamson has asked, will the county use second doses for first doses with the expectations that they will get more doses?
I want you to know that we are putting shots in arms within 5 days, which is the state standard, and in most instances we're doing it within 3 days. But the goal of the county is to put as many shots in arms as quickly as we can, and we're certainly following the advice and the direction of family hospital systems, which is just a wonderful example of a small business doing yeoman's work. We are not delaying, we are not holding back doses, we are putting shots in arms.
And we will at this time take one final question. If there is anyone in the group right now that would like to put that question on the chat. In the meantime, I would also like to share that we do have an FAQs in Spanish that can be found on our coronavirus website, and I will share our website here on the chat. The second portion of Williamson's question was, how will people be notified for their second dose?
So every person that's going through our mega vaccination center are the ones that have gone through Sun City in the last week. They've all received a piece of paper with a date and an appointment on those if it's been through family hospital systems. The other hospitals or medical facilities that provided that first vaccine, it is their responsibility under law to notify folks when the second dose is ready.
At this time, I don't see any further questions. Thank you, everyone, for joining us this morning. If you need further information, please reach out to publicinformation@wilco.org. Thank you for your time. Have a great day.
God bless you guys. Thank you.